My name is Melissa, and I'm one of the nurses on the orthopedic unit. I'd like to tell you a little bit about what you can expect when you get to the post-op unit right after your surgery. Most patients stay in the hospital until late morning of the day after surgery. Some patients may be able to go home the day of surgery if there is adequate home support and their doctor agrees to it. When you arrive to your post-op room, you will meet your nurse and patient care tech who will check and monitor your vital signs and breathing. The intravenous fluids that you received in surgery will continue until you are eating and drinking well, and then the IV fluid will be stopped and disconnected. Your IV catheter will remain in place for antibiotics or other medications as needed. During surgery, you may or may not have a urinary catheter placed. A urinary catheter is a tube used to drain your urine into a bag. The catheter will be removed in the early morning on the day after surgery. After the catheter is removed, or if you never had a catheter placed, staff will monitor your urine output until you return to your baseline. It's common to urinate small, frequent amounts at first. We want to make sure you are fully emptying your bladder because retaining urine can cause problems. Staff use a bladder scan to monitor the urine in your bladder until the volume is very low. A bladder scan is an ultrasound device that is briefly placed on your belly to read the amount of urine present. This does not hurt and takes only a couple of minutes. After arriving in your hospital room, you will be helped to walk within 4 hours, but it may be sooner. Many patients get up and walk within the first hour. Walking helps decrease pain, helps you to take deep breaths, and increase blood flow to your legs. It's one of the best things you can do. Physical therapists will talk with you more about exercises and this process. After exercising and periodically through your stay, cottage staff will place an ice pack on the site of your joint replacement. This helps decrease pain and swelling. You should continue to use ice this way in the weeks after you return home, especially after exercise or standing and walking for an extended time. Your nurse will assess your pain level regularly and provide medications as needed, in addition to using ice, positioning, and walking to help alleviate pain. During your surgery, medication will be placed in the joint area to provide pain relief. This medication typically lasts several days and helps minimize the need for narcotic pain medication. Narcotic use is something we want to minimize for many reasons. It often causes constipation, nausea, dizziness when standing up, sleepiness, and even addiction if taken for long periods of time. It should only be used when other treatments do not work. We want you to be able to get out of bed and walk, as well as rest at night and continue progressing, so staff will help decide what pain control will be best for you and talk with you about a plan for when you get home. So you know what to expect. Hospitals can sometimes be noisy places with check-ins, medications, monitors, and activity from other patients and staff. We encourage you to listen to music, keep your room door closed, or let staff know if you need earplugs to help you rest. Please take the time to read the Joint Replacement Guide, which provides more details on your surgery and recovery. We look forward to helping you through this important time.